Because of HealthPoint.
Because of HealthPoint.
Because of HealthPoint. I'm Kelsey Welch. I'm a physician assistant at HealthPoint's school-based health center on the Tyee campus. Tyee High School is in SeaTac near the airport, and the students here are from all around the world, from this area, very diverse. We have new families arriving all the time. So it's hard to believe it's been over 14 years since my first day at HealthPoint. Before coming to HealthPoint, I'd never even heard of a physician assistant, but I got to work with Michelle Parent over at SeaTac, and she was such an amazing provider, and that the PA that was here taught me so much and really inspired me to continue on with my education. So after a few years of being at HealthPoint and working with the awesome PAs that I met here, I decided to go for it, and I applied for PA school. Actually, when I had to put in my notice to move on and keep advancing my career, when I went and told my manager, I bawled. I was so sad to leave the students and my coworkers, and I just loved the setting so much. It made me so sad. I applied locally and on the East Coast, and with the experience I got at HealthPoint, I was accepted and moved across the country, learned a lot full-time, 2 years straight. For a few years after graduation, I worked for another community health center out in North Carolina, and then knew I wanted to come back to the community where I grew up in South King County. And I don't know how it all lined up, but when I was looking, the Tyee medical provider position was open, and it was just perfect. Because of HealthPoint, I became a physician assistant and now can help teens become healthy adults.
A lot of the students that we see at our school-based health centers might not have access to care outside of the school, and so it's extremely important. You know, we deal with a lot of homeless youth as well who use our school-based health centers as their primary care provider. Hi, my name is Anissa Wallace, and I work for HealthPoint's school-based health program. I am our program manager. Because of HealthPoint, I have found a career and work that I am truly passionate about. I love working for school-based health because the relationship building that we do with our adolescent patients, and just being able to teach them the importance of preventative health and hoping that they will grow into healthy adults.
Hi, I'm Thalia Martinez. I'm 19. I graduated from high school in 2021.
I got diagnosed with depression. I think it was my beginning of 8th grade year. I was really, really sad for a long time. You know, I wouldn't come out my room. It would be hard for me to talk in the morning, even if I just needed to say good morning, you know, to my mom or anybody really. It was just really, I feel like it took a lot of my voice away. My mom suggested it, HealthPoint, to me. She told me that it was free and they were helping just students, and I said yes. I just wanted to see what it was like.
Because we have an understanding of the need for behavioral health services in the adolescent population, even if a patient is coming in for a vaccine update or a well child check, or because they have a stomach ache, we're going to give them a screener, and if it's positive, we have our behavioral health provider there to hand them right off to. So with that handoff, the student is able to not only have their medical issue addressed, but they're able to talk to someone, and for a lot of them, it's the first time that they've ever been able to talk to someone.
I think it helped me mentally, definitely. I had a counselor, and she was really nice, very open, and really got me to get used to her and get comfortable with her. I was able to tell them, you know, that I was in a relationship. It didn't matter if it was a straight or a lesbian, bisexual relationship. I think that helped as well. They knew my potential, and they knew that if I just took it one day at a time and I just asked for help when I needed to, just like I was getting help already by the counselor, you know, I could do the same thing at school too.
She started to open up and she started to come consistently. And we just watched her blossom. We watched her kind of redirect her lifestyle and kind of get back on track, and understanding the amount of, you know, suicidal ideation that there is among our youth. Having the behavioral health there to be able to step in for that handoff and really establish care and let the student know that they care and that, you know, we're here for them, it can really be the difference between life and death.
Even days at home, sometimes, you know, I'd be feeling anxious or just wasn't having the best day, or I'd be crying or something, and I knew that if I just tried to calm down and just breathe and just really just know that it's not the end of the world, you know. I could definitely de-escalate the situation. They always kept contact with me, which was nice. Like, they didn't forget about me. They let me know you can call our 24-hour lifeline, or, you know, just that somebody was there even if it wasn't them. Do not wait to get help. It'll be so much better when you just feel so happy and like nothing's bothering you, and that you can just go throughout your day. I think because of HealthPoint, they bettered my future, mentally and physically and health-wise as well. I know that I wouldn't be to the point I was now if it wasn't for that journey that they gave me. Everybody deserves to be happy.